really looking forward to your presentation and welcome you to the stage.
So thank you for that very generous introduction. Continuing on the theme of workforce, I'm presenting our team's research on exploring the potential impact of integrating pharmacists into general practices. So very much trying to optimise the skill mix within pharmacy in Ireland at the moment. So to give a bit of context as to why you'd want to do something like this, I suppose both internationally and in Ireland recently there's been increasing reports of pressures on general practice teams. I think this figure here from a report called Understanding Pressures in General Practice sums it up quite well. So it identifies things like patient factors. So patients are more than ever now expecting rapid access to care, have increasing expectations and are increasing in their complexity as patients are living for longer with more medications and more diseases. There's also supply side issues, so funding and workforce shortages, particularly GPs in rural general practices. And there's also systems factors as well, like the delivery of new services. So for example, the chronic disease management scheme would be an example of a new service that has started up in general practices in recent years in Ireland. There's two quotations here on the slide. One illustrating the potential future workforce shortages in general practice in Ireland. So the HSE predict that there will be a shortage of approximately 500 to 1,400 GPs by 2025. And a study by Claire Collins from the ICGP in 2021 highlighted that over 29 million consultations are taking place in general practice per annum, and that innovative interventions to increase the capacity of general practice are required. So one such intervention in several jurisdictions has been the integration of pharmacists into practices. So while they don't work widespread across practices, in light green there on the map, pharmacists work in general practices in the United States, Canada, Australia, New Zealand, Iceland, the Netherlands and Slovenia. But the one country that stands out is the UK there in dark green, where they work widespread across general practices and primary care networks. So recent estimates place about 4,700 pharmacists working within general practices and primary care networks in the UK. So you might be wondering, what does it look like when a pharmacist works in a general practice? So shown behind me here on the slide are real pictures of pharmacists working within GP practices. So they do things like they get involved in the management of chronic diseases. So there's an example there of a pharmacist taking a blood pressure. But other examples would include like asthma and diabetes. Pharmacists spend a lot of time conducting medication reviews, either in person or over the phone with patients. So there's an example there of a pharmacist on the phone doing a medication review. And then they also do things like participate in multidisciplinary team meetings with GPs and practice nurses. So they might be involved in the discussion of care for a patient with quite complex medication needs, or they might perhaps do a brief presentation on presenting new information on a newly licensed drug to the practice team, and I suppose in a kind of an unbiased way rather than a pharmaceutical rep, which would have traditionally delivered that information to practice teams. But it doesn't end there. There's several roles that pharmacists undertake in practices, including things like managing or optimizing the repeat prescribing process. So in the UK, they're heavily involved in this, given that pharmacists have been prescribing in the UK since 2003 as supplemental prescribers and as independent prescribers since 2006. They also do things like review hospital discharge prescriptions, which we know both anecdotally and from the literature often have several omissions or errors contained within them. So they try to resolve these any omissions or errors, to kind of take that burden off the GP and from that perspective. They also conduct audits or quality improvement projects within practices. So for example, they might identify all patients on a certain high risk medication and undertake to ensure that all the appropriate monitoring has been done to kind of bring up the compliance in certain areas within the practice. So what are the outcomes of pharmacists undertaking roles within practices? So there's several. So the clinical outcomes that have been shown have been significant improvements in the control of diabetes, cholesterol, high blood pressure, reduced cardiovascular risk. In terms of economic outcomes, pharmacists have been shown to reduce expenditure on medications and reduce hospital bed days. In terms of health systems, more broadly, they've been shown to significantly reduce emergency department visits and improved access to appointments with GPs. For patients themselves, patients report improved medication adherence, understanding of long-term conditions, and overall satisfaction with their care. And then for the perspective of healthcare professionals, in terms of GPs report integrated practice pharmacists improve the time they have to spend on patient-facing activities, report an increased sense of prescribing support and a better work-life balance. And then pharmacists themselves who are integrated report a greater utilisation of their skill sets that they would have developed during university and greater job satisfaction. So where would we get all the pharmacists to undertake this role in Ireland? So Ireland actually is quite high up in the OECD table in terms of number of pharmacists per 100,000. So we actually have 21 more pharmacists per 100,000 than the UK, who have widely integrated pharmacists into their practices. Would pharmacists even want to work in a GP practice? My colleague, Dr. Kieran Dalton in UCC, conducted a recent study where he asked community pharmacists that very question. So this is a quotation from one of the pharmacists interviewed. So huge appetite for change amongst pharmacists, and there's that, they recognise that the health services are under so much pressure, and they feel that they're willing to chip in and perhaps try that role within a general practice. So in light of all that, what did we do? So I suppose very much tried to focus in on the GPs who, as research would show, are very much the opinion leaders within the primary care setting, and often interventions or new innovations aren't well adapted unless GPs have been brought in as a key stakeholder. So in considering this, we conducted a literature review of the scientific evidence for looking at GPs' views of pharmacists working in general practices. Then based on this, we conducted an explorative interview study where we interviewed GPs about the possibility of integrating pharmacists into their practices in Ireland, and then based on issues identified in the interview study, carried out a more broad survey study where we surveyed 152 GPs across Ireland to kind of tease out those issues identified in the interview study, but also identify maybe practices or GPs that may be particularly suited or in need of a practice-based pharmacist. And then finally, to wrap it up, we conducted an intervention where we actually integrated a pharmacist into 5 GP practices where they led medication reviews in conjunction with participants' GPs, and then we looked at the clinical and economic outcomes of that. So, our review of the literature, what did we find? So we identified 19 studies globally that had sought the views of GPs towards working with pharmacists in general practices. And we actually found that little research had been conducted to examine GPs' views prior to the integration of pharmacists into practices. So very little stakeholder consultation going on before attempting to integrate pharmacists. And then in terms of the research that had been done with GPs who had worked with practice pharmacists, GPs report pharmacists particularly useful for the management of patients with complex medication needs. So they describe these as older adults prescribed several medications with several long-term conditions, which is one of the key issues driving pressure in general practice, is that people are living longer with more conditions and more medications. GPs mentioned the importance of having a well-defined role to prevent overlap with other roles such as GPs and practice nurses. GPs reported that pharmacists in their practices improve patient safety and practice capacity, but they did acknowledge that external funding is needed in order to support the integration of pharmacists into practices, and GPs felt that they were unable generally to support the role financially solely by themselves. So then based on that, we conducted our explorative interview study with 17 GPs in Ireland, where we sought their views on integrating pharmacists into their practices, I suppose, but with the context of the Irish setting in mind. So we actually found that GPs were primarily very positive and welcoming towards general practice pharmacists in Ireland. So here's a quotation from a GP from our study. So again, emphasising the utility of a pharmacist in a practice, particularly for those patients with multiple comorbidities, prescribed several medications, who they feel are quite complex in terms of their medications to manage. And the quote finishes here: they feel input from pharmacy would be very beneficial for these kind of complex patients. Other findings from our interview study included that GPs predicts that pharmacists would encourage more evidence-based and cost-effective prescribing, improve patient outcomes and practice capacity. However, concerns regarding workload are present, particularly where pharmacists, which is the situation in Ireland currently, cannot prescribe. So there is a worry there that if a pharmacist performs a medication review and then generates a number of recommendations, then a GP will have to review those recommendations and implement them, and that might increase their workload somewhat. And then finally, the issue of funding. Again, GPs were uncertain of exactly how the role would be funded in Ireland, but again, felt that there shouldn't be a level of, I suppose, support from the government in funding the role of practice pharmacists, which is illustrated in this quote behind me here. So initially, it would have to be HSE funded, but GPs, if they see the value of it, would be happy to part fund it then on an ongoing basis, which very much mimics the model in the UK currently, where the NHS covers 70% of the practice pharmacist salary, and then the primary care network or GP practice meets the other 30%. So our survey study then, where we wanted to explore some of the findings of our interview study and try to identify practices best suited, we were very happy to see that when we asked the question of would you ever like to partake in a pilot of having a pharmacist integrated into your practice, the majority of GPs, nearly 80%, said they would. And although you might say, okay, well, 1 in 5 said they wouldn't, when we looked into this a bit more, it was that the majority of those who said they wouldn't, it was simply because they didn't have space to actually accommodate a pharmacist within their practice. And so keeping that issue with the space in mind, based on our analysis of the willingness to partake in a pilot, perceived cost benefit of having a pharmacist in their practice, we identified a type of practice that would be possibly best suited to the initial integration of pharmacists in Ireland. So those would be those purpose-built primary care centres, possibly in a more urban setting, and with at least 2 or more GPs working there. And again, in terms of funding, when we asked the question again, GPs felt that the role should be at least there would be, nearly all GPs said that there would be a degree of government funding needed to support pharmacist roles within practices. And then in terms of what it would look like, a one-size-fits-all model may not be suitable. When we asked the question about how often would you like to have a pharmacist working in practices, we had smaller practices expressed a preference for perhaps a part-time pharmacist that might be shared between multiple practices, versus larger practices who might have the need for the full-time pharmacist. And just building on what the role would actually look like, again, the graph behind me shows the spread of acceptance across different potential roles for a pharmacist to undertake within practice. So up the top there, over 90%, very high levels of acceptance for GPs and need for pharmacists to conduct roles like providing medicines information in practices, both to practice staff and patients, conducting medication reviews, liaising with community pharmacy, for looking at hospital discharge prescriptions and checking for errors and omissions, and doing things like demonstrating medical devices, so perhaps a newly initiated inhaler or injection. But then down the bottom, much lower levels of acceptance for roles like vaccinating or triaging and managing minor ailments like hay fever. When we explored the reasons for this from the qualitative results from the survey, this was actually often attributed to GPs felt that those roles might not be the most appropriate within general practices, given the need to maximise the skill set of the pharmacist in the practice and perhaps focus more on those medication-focused roles rather than things like vaccinating. And interestingly as well, significantly lower levels of agreement on the bottom there for pharmacists conducting independent prescribing within practices. Again, this possibly due to the wording of the role itself, and perhaps a more phased approach as was undertaken in the UK, where they were first given supplemental prescribing rights and then independent prescribing rights, may be more appropriate for the introduction of pharmacist prescribing within general practices in Ireland. So our actual intervention itself then, we integrated a pharmacist across 5 practices where they conducted medication reviews in conjunction with participants' GPs. So they reviewed 99 patients. We found that the pharmacist-led medication reviews was able to decrease on average 1.4 medications per patient. There was a significant decrease in measures of appropriateness of prescribing, so a significant decrease in the overall inappropriateness, including the use of sedative medications. We found that while there was no significant difference in quality of life hospitalizations, A&E visits 6 months prior to and post the intervention, the similar was also seen with falls, but there was actually a non-significant trend in a lower number of falls post-medication review. So that's kind of a testament to the safety of a pharmacist-led intervention within the general practice. And interestingly as well, in terms of time taken to actually conduct the intervention itself, majority of the time was spent by the pharmacist reviewing the medical history, looking at the medications, so 35 minutes on average per patient, and then the GP spent 3 minutes on average reviewing the recommendations given to him or her by the pharmacist. So significant potential time savings there as a result of the pharmacist conducting the review from start to finish versus the GP having to do it all themselves. So we looked at the cost effectiveness of those reviews across the 99 patients. We determined, based on avoided adverse drug events like a fall, which may subsequently lead to hospitalisation from a sedative medication, we determined that there would be approximately €61,000 in avoided expenditure. And we calculated the cost savings from stopped or dose-reduced medications, in addition to savings on pharmacy dispensing fees. We calculated €27,000 would be saved on the year following on from the intervention. And when we add those two figures together, subtract the cost of actually providing the service, we calculated an overall net cost benefit of approximately €85,000, which produces a cost benefit ratio of 33.2 to 1, meaning that for every euro invested in the intervention, the public healthcare system will expect a return of €33.2. So, take-home messages for policy. We think that this body of research has laid the groundwork for the potential for there to be the larger scale integration of practice pharmacists in Ireland. Our pharmacist-led intervention in GP practices was efficacious in terms of reducing medications and inappropriate medications. It was also shown to be safe, certainly shown to be cost-effective. We've shown from our qualitative research that GPs are certainly willing to engage with this potential new novel role for pharmacists in general practices, and as are pharmacists themselves. However, government funding key barrier identified across our research in order to enable that willingness to participate in this new novel intervention within GP practices. And our research has also identified a number of key supports in order to support the development of practice pharmacist roles. Legislating or training for pharmacist prescribing, as I said again, perhaps in a more phased approach, as in supplemental then independent prescribing as per the results from the survey study. Pharmacists likely to require professional indemnification to work within practices was also identified as a key issue in our survey study, and space certainly a key issue for being able to actually accommodate a new healthcare professional in your practice. So perhaps those purpose-built larger primary care centres may be a more appropriate setting to start off with the integration of pharmacists. So just want to say thank you to the Irish Research Council for funding this work, and also my supervisors. It's a purely joint collaboration between the School of Pharmacy and Department of General Practice in UCC. So supervisors from the School of Pharmacy, Professor Stephen Byrne, Dr. Kieran Dalton, and from the Department of General Practice, Professor Tony Foley and Dr. Elaine Walsh. Any questions, more than welcome. Thanks.